I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have a really interesting guest today, Nick Alexander. Welcome, Nick.
Thank you. Nice to meet you.
So, Nick, we're here at the NASD's conference, which is the National Association of State Developmental Disability Services. You know, so many letters.
Yeah.
I got to know what you do in the field, and I'm like, this is pretty cool. This is pretty intriguing. So, I know your background is technology, right? So let's start there,
okay.
And then we'll get to what you're doing related to IDD
Sure.
supports and services.
Yeah, sounds good. So over 15 years in innovating technology. And so that's been with several different companies, but it's all been in a very regulated space. So started more on the engineering side. So my background's in industrial engineering. And then as I got into the field, it was more for electricity, gas distribution, nuclear power plants, really regulated industries.
Now I'm really curious how you got into
I know,
working
right?
in this field. Yeah.
But it was always about complex challenges and complex problems.
Okay.
And so over the past, I'd say really 6 or 7 years, it's been a lot of focus on the healthcare side of things. But what I've found is a strong relationship between other industries, including these regulated ones or logistics, and how we can bring that and help out healthcare as well.
Okay.
Yeah.
So how are you helping out healthcare?
Yeah, so really over the last 4 or 5 years, there has been a lot of focus on some innovators coming to me and my team, and really asking kind of the probing questions of how do we do better? And it really takes some visionaries that really want to make some change, and they have a vision for where do we want to go, and then we'll start helping them figuring out how to solve the right problem.
Okay.
And it really got started with Care First, and it got started on the senior side. So really helping out seniors on their ability to stay independent, which is similar but slightly different than the ability to gain independence.
Sure.
But independence has been the common theme.
Okay.
And so really working with seniors, interviewing them, and treating care first on how do we help versus putting technology first.
Okay. So how do you help seniors maintain independence?
So it really started as an access platform, and the thought was, how do we make it as simple as possible for somebody to get 24/7 medical care at the touch of a button?
Okay. So in a word that we're probably more familiar with, it's kind of telehealth.
It's kind of telehealth.
Kind of telehealth.
Kind of telehealth.
Okay. All right.
I think the biggest aspect of it is it's telehealth with the social side as well.
Okay.
And I think that's one of the big differences.
I like that. Yeah.
Yeah.
So talk about how it works. Give us an example.
Yeah.
Yeah.
Well, when we started out, we did think it was going to be mostly telehealth. What we got a lot of was it's 2 a.m., I'm feeling depressed, and as a senior, I didn't want to bug my son or daughter with a phone call.
Okay.
And that raises a lot of issues, concerns, especially with some stigmatisms that go around with the ability of feeling independent for seniors. And what really came out of a lot of the interviews and conversations we had, a lot of people, when they think about technology with seniors, they worry about all the trips and hazards of, how do you get adoption and how do you work with them? But what really came out was, how do we solve, again, the right problem for those seniors? And a lot of overnight, after hours, it's not your standard work schedule that they're awake and that they need help.
Mm-hmm.
And so how do we help them around the clock? And that's where this really came out of.
Okay, so some of the calls you mentioned, hey, I'm feeling sad,
Yeah.
and I need somebody to talk to.
Yeah.
Or, hey, let me tell you about what happened today, or whatever it might be.
They could have got a new puppy. They love talking about their new pets.
Okay.
It could also be helping arrange a ride.
Or like you said, hey, I need a ride here or there. So that's that social component
Right.
of this platform. And when we say platform, we're talking about, I know you've got like a device, or it could be their own device,
Yeah.
and it's basically a way to connect with someone who can support their needs on the other side.
That's right.
So you've got the social component of it in that way, and then you also have the healthcare component of it,
Correct.
right? So, and we're talking about seniors, but that has evolved into people with intellectual and developmental disabilities
It
also,
has.
right?
Yeah, absolutely.
Same types of services?
Same types of services, almost exactly the same. I think the one interesting pivot that we made, especially when we got to those with disabilities, was being more specific with their care plans and really focusing on how they could specifically use a service like this, and giving them examples. One example of that being, we worked with an individual. She lives an hour away from supports, a lot of rural access to care here.
Sure.
And she was taking a blood pressure cuff reading once a day, every day, and having to report and call that in, or having somebody come out and visit her and them having to do the reading. And so her being able to feel independent and being able to do this herself, calling in through the device. She calls in at 4 o'clock every day, gives us that reading. She's got the best disposition. She calls and tells us about it, and she feels great about it. And now she gets more time back.
So you've got both the social aspect and the health aspect together.
That's
right
right
there. So what if somebody calls in and let's say they fell and cut their arm, or they are having a fever and some cough and congestion symptoms. What happens at that point? So, or let me back up.
Sure.
Person calls in, and who do they reach first? And then let's say they tell you they have these medical symptoms. What happens from there?
Yeah, it starts with a care coordination team, and that coordination team could be a variety of individuals, but the key component is that it's care first and social first, and so it's about the established relationship, and so they'll probably have known that person, or they've talked to that individual before. So it's not just another name that's coming across, but they actually, since it's a video visit, they've seen this person before, they've built up some trust, and so that's what led to better medical outcomes or conversations. So they call into this care group, and there's a quick triage, and it's, okay, do I feel like this needs medical attention or not? And then if there is medical attention required, then we bring on, the provider on the line. Okay,
so the provider, where do the providers come from? Like, do you have them sitting around just waiting, or how does it work?
I wish we all had that.
Don't we?
We partner with groups. And so what we realized early on was, we are a technology company. And although we're care first, there are provider groups that are really good at what they do. And we want them to do that. And we also found that there are provider groups that help these individuals in every state, and it's localized as well. It's not just a national effort. And so how could we partner with groups in individual states or different groups that could help these individuals, but they know the care that's required? And so that's been a big part of it, is bringing on these providers and letting them do what they do best.
And you guys, so you basically facilitate that connection between the care coordinator and or the healthcare provider and the person who needs that assistance.
And the key is it's a warm handoff. So all three are on the call at the same time.
Nice.
And so the care coordinator can either stay on the call with that individual, or they could drop off and leave it as a private conversation between the provider and the individual.
So where is this occurring right now? Where are you guys working?
Yeah, we're across 7 states right now. One of our biggest efforts around those with disabilities is in the state of Indiana. And we've been partnering with an organization there, Easter Seals, and they've been a great partner and really helping us learn the different facets of individuals with disabilities, because one individual.
Yep.
And so it's how do we serve in different ways? How do we serve those that might be part of a jobs program and they're going out and they do have a full-time schedule, or an individual that's more in a group home and they have different needs and assessment needs that are required.
So I would bet that you probably have asked some of the people that have used your services how they feel about it.
Absolutely.
Tell me what that looks like.
Yeah. This is where, of course, all the heartwarming stories come from, and
let's tug on some heartstrings here.
It's fantastic just to see the face light up, right, and say, I feel like I am making a connection with somebody that's on the other end, where before it might have just been an audio phone call, and you're not really knowing who you're talking to and why you're talking to them. So establishing additional relationships for these individuals. And then also, I come back to this theme of independence, but every step along the way where they feel that they can get care and they're doing it themselves and they're not required to reach out to other supports, they have it right in front of them. It really just helps them on that journey.
Now, we missed probably something really important. What's the name of the company?
Never Alone. Never Alone, and it
right.
came from really focusing on, there's such an isolation sometimes that happens with both individuals with disabilities and those seniors. And, how can we help them feel part of a community, and it can be on their terms.
So if people have an interest in learning more about what you do, where do they go?
Yeah, neveralone.com is the easiest spot. I'd love to talk to anybody that's interested in it. One of the big things that we're also doing is looking for key partnerships and figuring out how we get the word out. And that's where conferences like this are really important.
I'm Dr. Craig Esquire, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support.
So, Nick, one of the things that I always ask guests is to tell us 3 things in 3 minutes or so that you think can improve the world for people with intellectual and developmental disabilities, and in your case for seniors as well. So what are your top 3 things you want everybody to know?
So I think there's an interesting difference between where healthcare is at and where innovation's at across the globe. And that's for all ranges. I mean, that's for us. Yeah. That's for individuals with disabilities. That's for seniors. That's whoever it is. And sometimes I think one of the main issues there is technologists like myself. We know that we can do AI work. We know that we can do things, for any piece of technology. But what it comes down to is what's the right workflow for the user, what will make them really be successful. And so leading with that care lens, leading with what is the right problem to be solved, rather than leading with, hey, look at all these cool technology things.
I like that. So know the problem that you want to solve and solve the right one.
Right.
Number one.
Yeah. And part of that is, there's a huge team behind that makes that happen, right? Sure. And there's research involved, and there's design involved, and it's product management really leading the way on what are those requirements. And then, of course, there's the whole development team. And some of that's taken for granted a little bit.
So number 2 is maybe that it's not just a thought. There's a whole lot behind that idea that comes into play. And so I guess put together the right team and
continue to innovate. You're not going to get it right the first time. And it's going to take some time, but you got to be patient with that process. And ultimately, you have to talk to users as quickly as possible. You can't just let this sit and think you're doing the right thing.
All right. You got a third?
I don't know. Just more kindness. Sure.
Kindness. How about that? That's a great third.
Yeah.
All right. Nick, thank you for telling us about what you're doing. I love, the bridging the technology and healthcare. It's important. It's needed. It's the way we're going. We might as well try to do it right and innovate it correctly, right?
Yeah.
But thanks for talking with me and telling me about it. And again, it's neveralone.com.
Neveralone.com.
People are interested in learning more, and can't wait to see where this goes.
Thank you. I appreciate it.
Thanks for joining me.
Yeah.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.